As Rwanda has stepped up its efforts to prevent the spread of COVID-19, the Ndera Neuropsychiatric Hospital has also stepped up its efforts to protect patients, although from time to time they might not understand the country's current situation. We test them very often together and we know how they stand. We don't put them together with the newcomers or the visitors, and we don't let visitors get to them. No visitor is allowed except when necessary during the patient's treatment. Administrators at the psychiatric hospitals say that one of the effects of the COVID-19 pandemic has been an increase in the number of patients coming in. The number of patients has increased, even those that had recovered deteriorated because of the challenges this pandemic has presented, and some patients didn't even have transport money to come here. Many critically ill patients are hospitalized, and there are those we had to readmit, hence the increased numbers. The COVID-19 pandemic has also left psychiatric patients with inadequate care in various families, something caregivers ask to be looked into. There are some that become desperate and say after all they aren't working or going to school and wonder what they are fighting for. Combined with these drugs, it's important that these families take care of these patients properly. While we were under total lockdown, the patients faced great challenges. They lacked medicine during that time and people didn't treat them well, even talk to them as they should. We ask that Rwandans change their perceptions towards mental health and realize that a person can be treated and completely recover and become useful when they return to their society as they were before, and especially if they are well received, that too is a part of the healing process as well. The department that specializes in dealing with drug addicts at the Ndera Hospital, as well as those affected by trauma, says that drug abuse is the main reason for high numbers of patients being admitted, from 44 patients in April to 75 in June this year.